Bismillah Rahman Rahim. Once again, today the topic of my presentation is macrolide. Macrolide, this is the group of antibiotic which have the capability to inhibit the growth of microorganism as well as to kill it. It means that macrolide is basically dose-dependent bacteriostatic and bactericidal effects, broad spectrum mostly from 4 gram negative, 4 gram positive, only few gram negative covers. The mechanism of action or mode of action of macrolide, because we know that how these drugs can target the microorganisms. So there is a competition between microorganisms and antibiotics. The mode of action and mechanism of action of macrolide is basically this drug inhibits the bacterial growth by interfering with protein synthesis and bacterial cells. As we have discussed in previous lectures, that why these antibiotics are used to kill the growth of microorganisms. It may be in the form of bacteria, it may be in the form of fungus, it may be in the form of virus. Here the point which I have noticed, that is why these antibiotics are used to kill the germs of bacteria, because they can only destroy the cell wall of the bacteria, not the human cells. Because these antibiotics, they are synthesized and prepared from various microorganisms. So macrolide is a group of antibiotic which is responsible to inhibit or stop the bacterial growth by interfering with the protein synthesis and bacterial cells. So whenever there is the formation of proteins and the bacterial cells, so then the chances of the infections will be increasing, while if the protein synthesis, it can be inhibited or it can be stopped. So we can say that the macrolide group, it is much and more effective against these germs. These are the examples. Look at here. The first one is this is erythromycin. So erythromycin belong to macrolides, azithromycins, clarithromycins, and spiramycin, roxithromycins. All these drugs are available. It is not necessary that each and every drug will be available in the market. If I can say that erythromycin, that is available in a market by its trade names erythrocins. Stearate at the dose of 250 and 500 milligram. So there are many brands which are available in the market, but there are some drugs which are still under investigation. So here I can say azithromycin, clarithromycin, like Clarisate, azithromycin, and spiramycins and roxithromycin. All these drugs, these are the classical example of macrolides. Now, how these drugs are used, the clinical indication, macrolide, they are used in the treatment of urinary tract infections, UTI, like skin infection, pertussis, bordetella pertussis, syphilis, diphtheria, intestinal infection, alternative used in penicillin G allergy. So these are the drugs which are used in the variety of infections. Now look at here, these are the side effects which are reported by macrolides. So let's suppose if macrolide is used, there may be chances of mild and severe hypersensitivity reaction, epigastric pain, diarrhea, reversible hearing impairment, and hepatotoxicity or jaundice. There are different type of routes of administration, so we can say that this drug macrolide, it can be given orally, intramuscularly, or you can say it can be, they are available in parenteral dosage form, so it can be also administered to the patient injectively in the form of